Classification has actually evolved over time into a very complex system that is informed by medical science and research. And what has evolved is the causation. This is Dr. Pius Kigamwa. I am a consultant psychiatrist and a lecturer at the University of Nairobi School of Medicine. Today's episode will be covering classification of psychiatric or mental disorders. In mental health, unlike in other fields in medicine, we tend to diagnose our conditions based on what is reported to us and what we observe of our patients and what the patients also report. So on the face of it, it might look like a very disorganized way of making a diagnosis. It might not look very structured, and many a time it looks like it's very subjective. But in reality, mental disorders actually follow the same diagnostic criteria that have been developed over time. And therefore, for us to make a diagnosis of a disorder, a patient must meet a minimum set of diagnostic criteria. We have different classification systems that enable us to make this diagnosis, but the two most commonly used are the International Classification of Diseases, which is an organ of the World Health Organization. And then there is the Diagnostic and Statistical Manual, which is an organ of the American Psychiatric Association. Within those classification systems, you will find a specific diagnostic criteria. So that if you go to South Africa, go to Cape Town, go to Cairo, go to New York, go to Japan, Tokyo, whatever, the story you give to your doctor should lead that doctor to arrive at the same diagnosis as a doctor in Nairobi. The whole question of what is a disorder can be a bit of a challenge. But we think for you to say somebody has a disorder, the illness, the symptoms, the profile of that condition leads to a certain level of dysfunction in the individual and also to people around them, so that anybody listening to them would say, there's something wrong here. There's something wrong with this person. This is not normal. But normal is relative. For example, if you are to look at the International or even the Diagnostic Statistical Manual and look at what constitutes mental retardation or intellectual incapacity, it's a range. They will say 95% of the population lies within an IQ range of between 90 and 110. And then 2.5% will lie outside on the lower end. They'll be referred to as having intellectual incapacity or handicap. And then those who are 2.5% above the 110, who really should be regarded as having a disorder, because then they are not within the so-called normal range, will be the people that attract accolades like very intelligent, clever, gifted, and so on. So it's really a definition that is based on a range. It's a statistical definition. And it then creates the impression that people are diagnosed as having a disorder just based on numbers. However, it is the dysfunction that it confers upon an individual that leads us to a diagnosis of a disorder. The fact that we are using the same standardized classification system all over the world, and they are specific. For example, if I want to make a diagnosis of depression, there is no magical test I'm going to do. I'm not going to send you to a laboratory and say, assay levels of the happy hormones so that we make a diagnosis of depression. But there will be common symptoms that we can all pick up. For example, say for you to make a diagnosis of depression, you must have at least 2 weeks of feeling low, sad, depressed, unhappy, or just the sense of loss of interest, feeling bored, not deriving pleasure out of things you've enjoyed doing in the past. And then combine that then with a specific number of other symptoms. They are what we'd refer to as biological symptoms like sleep disturbances, appetite disturbances, energy disturbances, disturbances in your sexual drive, libido, disturbances in how you feel about life. I mean, feeling hopeless, worthless, helpless, maybe even suicidal, feeling inappropriately guilty, small things that have happened in the past and so on. So these symptoms then, when put together, when they occur together within a specified period of time of at least 2 weeks, would constitute a diagnosis of depression. And so the person sitting in another country listening to you, and you talk to them and you say, these are the things I feel, should arrive at the same very diagnosis. So when we think about a classification, we're thinking about the different mental disorders. People walking in the streets and they hear you have been to see a psychiatrist or a mental health practitioner, just think about in local terms what you call the mad person in the village or in the market, and they think for as long as you're going to see a mental health specialist or practitioner, then you are mad in quotes, and therefore they look at you as that individual who is very badly dressed and dirty and unkempt, eating out of the bins in the local market. But in reality, there's a whole variety of mental illnesses, very specific and different, and they vary and have different causations. For example, we can say you have those we refer to as psychotic disorders. Psychotic disorders referring to individuals who've lost touch with reality, may experience hallucinations and delusions and live in their own world. And then you may have individuals who have what we refer to as mood disorders, where the primary characteristic is that derangement in mood. And so you can have depression, you can have mania, hypomania, you can have people referring to it as a bipolar disorder. All these are mood symptoms. Then we have anxiety disorders, generalized anxiety disorder, patients with anxiety arising out of traumatic experiences, acute stress disorder, post-traumatic disorder, You can have individuals with substance use disorders, and here we are looking at the various substances like alcohol, cannabis, and the hard drugs, cocaine, etc. Then we have individuals who would have disorders that relate to their gender, their identity, their sexuality. We can have individuals whose disorders have arisen in childhood, so we have childhood psychiatric disorders and so on. So there's a whole range of disorders, and each has very specific diagnostic criteria. If we think about when we all started with mental health, the kind of diagnoses that were presented out there included things like being lazy, having an immoral life, having a wandering uterus, sunstroke, spinal, backache, and so on. These diagnoses were not really very specific, and many a time a doctor would just come and say, I think you're suffering from mental disorder because I say so, without citing specific diagnostic criteria. But now it has evolved. From the days of a guy called Eugene Bleuler and Emil Kraepelin, these were the originators of classification systems. And if you look at the Diagnostic and Statistical Manual, it has evolved from the first edition, which is referred to as DSM-1, to now DSM-5. In fact, DSM-5 was launched in 2013. Usually the DSMs have a 10 or so year life, and then we have to upgrade to the next DSM edition. So the DSM-5, which is current in 2023 or thereabout, will probably be upgraded to DSM-6 to take into account all the research that has been taking place. And by the way, mental health has probably the highest level of research publications all over the world. So it's a very highly researched field. It's rapidly evolving. New methods of treatment are coming onto the market. Thank you for watching my YouTube channel. You can actually subscribe, you can like us by giving us a thumbs up. Thank you.